Hi, I'm Dr. Jennifer Sunken from Caring Dentistry for Children. I'm here to talk about sedation in the hospital setting for our pediatric patients. This is something that we do offer in the practice, and it's so important for patients that have a lot of cavities, are extremely afraid of the dental chair, or are special needs. Typically, when we do sedation, an anesthesiologist will put the patient to sleep. We will go in, take x-rays if we have to, do all treatment necessary, and then once we're finished with our treatment, the anesthesiologist will wake up the patient and bring them to the recovery room. This is so important for patients that really need it because we don't want them to be traumatized in the dental chair. We want them to come to the office and be happy to be here. So this makes it very easy for those patients to get their cleanings in the office and be happy when they come to see us. This is a same-day surgery. Typically, your child will come the morning of the appointment. They will be seen, put to sleep. I treat everything. They get woken up. They go to the recovery room until they're awake enough to go home. Easy 1, 2, 3. So typically the parents are allowed to go into the operating room. How the anesthesiologist puts the patient to sleep in most settings is the patient will breathe a mask, which goes over their nose, and once they're asleep, the parents are escorted to the waiting room. At that time, the anesthesiologist will most likely place an IV into the patient's arm and put the patient fully to sleep. So sedation is possible. It depends upon the patient and depends upon the extent of the cavities, the behavior of the child. So we take each patient case by case to determine whether general anesthesia is the best treatment option for them. This is a very safe procedure. What I like about being in the hospital setting is that you have all the doctors around you. I feel more comfortable seeing my patients in a hospital setting just because if anything were to happen, I know that there's enough doctors and care to provide to the patient.